Good morning. My name is Gabriella Goldfarb, and I am the Environmental Health Manager for the Oregon Health Authority. I'm starting with some pretty good news. Based on this morning's smoke coordination call among weather, environmental, fire, and health agencies, we're seeing good news coming soon for most of parts of Oregon in terms of smoke. People along the coast are already seeing good air quality, and we're optimistic that smoke in the rest of western Oregon will clear by middle of the day Friday, and central Oregon skies will clear over the course of Friday and Saturday. That might not be the case near active Oregon fires or places in southern Oregon that are being impacted by California fires. Smoke can be unpredictable, and along with these fires that are still on the landscape, we're going to have to just keep our eyes on the changing conditions and update you when we have more information. We are expecting rain tomorrow in many parts of the state that will help flush smoke from the atmosphere and hopefully help tamp down fires without bringing lightning that starts new ones. The exception to this is to this much improved picture may be far eastern Oregon, where Baker, Malheur, and Harney counties may have lingering smoke, though improving to less harmful levels into next week. I do want to urge people who do not live on the coast to sit tight for another day or two. Our first responders are still needing roads to stay clear for firefighting and for moving people who have been displaced by fires. It also really helps stop the spread of COVID. So please stay close to home, and the smoke will clear up for most people within a couple days. I'm going to leave it to my colleague from the Oregon Department of Environmental Quality, who you'll hear from next, to give us the details of changes to the current air quality advisory that agency issues. We will meet again, those weather, environmental, health, and fire agencies. We'll meet again in a few days to update the air quality advisory. So all that said, people are going to want to check their local advisory levels, and there's a few ways you can do that. One, on your smartphone, if you download the Oregon Air app for iPhone and Android, on your smartphone, that is a great way that you can look up and see what your air quality is right where you are for most places of the state. I will say again, part of the monitors for that system have been knocked out by the wildfires, but a lot of them are coming back online, and we still have good information for lots of places. Another place to go on the web is the Environmental Protection Agency's website, which is airnow.gov. AirNow is all one word, .gov. Once you see yellow or green, meaning moderate or good air quality, it's safe to open your windows and air out your homes. Of course, you can also tell a lot just by looking out your window. Unfortunately, we are still seeing the effects of smoke play out in terms of health impacts to people in our communities. As I reported earlier in the week, we are still seeing about 10% of all emergency room visits across the state are for asthma-like symptoms. So everyone can experience symptoms of smoke exposure, but there are some populations, such as pregnant women, because of the impact to a developing fetus, children, the elderly, people recovering from respiratory infections, and people who have pre-existing heart or lung conditions, or who have a respiratory disease like COVID-19 and are recovering from that. All of those folks are at higher risk, along with people who work and exert themselves outdoors. So the Oregon Health Authority and Oregon OSHA continue to strongly recommend that outdoor work cease when the air quality index reaches unhealthy levels or worse. When smoke does trigger a serious health effect, it will usually show up within a few days of exposure, but some people might experience effects up to a week or 2 weeks after the exposure ends. Until the smoke clears where you live, the message remains to stay inside and follow recommendations for making cleaner air spaces in your work or home. And you can find that info by visiting wildfire.oregon.gov. I want to turn next to smoke and COVID. So there is some overlap between COVID-19 and wildfire smoke symptoms, such as cough, runny nose, fatigue, difficulty breathing, and headaches. But smoke impacts don't typically include fever, chills, muscle or body aches, vomiting, loss of taste or smell, and diarrhea. If you have these symptoms, use the CDC's online COVID-19 self-checker to see whether you should contact your healthcare provider. Finally, OHA collaborated with the Department of Environmental Quality and Oregon OSHA to make sure people who may be returning to burned areas stay safe. And you'll find good information about how to do that by going to wildfire.oregon.gov. I want to turn it over now to my colleague from the Department of Environmental Quality. If you could introduce yourself.
Yes, thank you, Gabriella. This is Tom Roik. I'm the Air Quality Monitoring Manager for the Department of Environmental Quality. And as Gabriella mentioned, we do have some good news. Conditions are improving across the state. Our air quality advisory team is going to be watching conditions over the weekend, and we expect to have an updated advisory out through late Sunday or into Monday, so folks can get a sense of what things are going to be like from Monday and into next week. With that good news, I'm going to take us back to the last few days and where we've been. DEQ has over 50 air quality monitoring stations across the state, and they've been showing record poor air quality from wildfire smoke over the last few days. So, in fact, Oregon reached unhealthy or hazardous levels in all parts of the state on our air quality index. So the Air Quality Index, or for short we call it the AQI, is a color-coded index that shows how clean the air is, and it lists associated health risks for those different categories. And it runs from green color, being good air, all the way up to a maroon color for hazardous air quality conditions. We looked at 5 cities here in Oregon over the last couple of weeks: Portland, Eugene, Bend, Medford, and Klamath Falls. And we found that all 5 of those cities exceeded previous daily records for poor air quality during this wildfire season. So while this is unprecedented, it's not just that the levels have been high, it's also that we've seen smoke across the state, from coastal areas that rarely see these kinds of smoke intrusions, through the Willamette Valley and all the way to the eastern part of the state. Gabriella mentioned some resources. The information that DEQ provides on our air quality index is available to the public. So a good place to go to get information is the Oregon Smoke Blog, which is at oregonsmoke.blogspot.com. It's basically a one-stop website where you can get information not only about air quality, but you can see how the air quality matches up with where there are fires currently active around the state. And you can also get real-time air quality information from an iPhone and Android mobile apps. So you can look for Oregon Air and download for free those telephone apps, which will give you real-time information from all the 50-plus monitoring stations we have around the state. This time of year, the emphasis is on particulate from smoke, so what you're seeing mostly on the air quality index, and then that color-coded scale is concentrations of particulate and how that ranks on the AQI. One last note is while we're saying this is really unprecedented conditions, we've had record high concentrations of smoke across the state. Something to keep in mind is that this is a trend that we have been seeing for the last, say, roughly 5 years. We saw seeing increasing incidents of wildfire and wildfire smoke across the state, including into cities such as Portland, where it's been fairly rare in the past. And so the message there is, while folks are doing things now to address the current conditions, some of those things you're doing now may very well be applied to preparing for future events and even preparing for wildfire season next year. So things you could be doing, such as having extra home air filters for your air system, or buying portable devices for rooms in your house if you don't have central air, or sealing your windows and doors to prevent smoke coming into your house. All those things that Oregon Health Authority and our other partners are providing recommendations. Think about the consideration that if these kinds of events continue into the future, it's great for folks to prepare for that ahead of time. So I think those are my main points, and I'll hand it over to Michael Woods, if you'd like to introduce yourself.
So I'm Michael Wood, and I'm the administrator of what is technically the Occupational Safety and Health Division of the Oregon Department of Consumer and Business Services. For obvious reasons, we just refer to ourselves as Oregon OSHA most of the time. And as Tom noted, this really has been an exceptional time, at least from a historical perspective. And in that context, we really believe that it justifies some extraordinary measures. And so last Friday, in partnership with the Oregon Health Authority, we made a very strong recommendation with regard to outdoor work, that employers and workers delay or stop outdoor work activity, particularly strenuous activity. And we went through a number of steps to help folks understand how to address that. There are steps. Some work can be delayed, some can be stopped. Work schedules can be rearranged both to hit points when the smoke is not as bad, but also to just minimize the amount of time any individual is facing it. And there are protective masks that can be used. Now, it's important to remember, in this case, when we're talking about masks, we are talking about respirators. And so the sort of masks that we're talking about are N95s, or in this particular context, also KN95s, not the facial coverings that we've all been dealing with in the COVID context. Almost immediately, of course, we get a question saying, well, is this required? And the answer is, it is not required, but it is a very strong recommendation from two agencies that are concerned about the health of workers and of the population of Oregon at large. And the strength of that recommendation increases the higher up that scale you go. The recommendation applies to every place where the air is unhealthy, very unhealthy, or hazardous. Obviously, our concern is greatest where the air is hazardous, and that's been many parts of the state, and continues to be an issue. But it's a concern at all levels, particularly with strenuous work, particularly with work that involves the entire work shift being outside without any relief. That isn't likely to exceed the regulatory limit, so we're not talking about addressing this in an enforcement context, but we are talking about an important issue, and we really think that employers will want to take it seriously and will want to take the measures that they can to protect their workers, both out of a sense of responsibility and recognizing the importance of those workers to their continued operations and activities. It's not unusual that Oregon OSHA recommends practices beyond what are required, and certainly in tandem with the health folks, that's what we're focusing on here. It is important to address this issue, and our focus should be on what we can do rather than simply on what we must do. The recommendations may not be requirements, but we want to be clear that that doesn't mean that we approve of employers disregarding them. We issued them for a reason, and we hope that everybody in the state will take them seriously. I do want to talk just briefly about the so-called the KN95s. It is normally a requirement that to use a respirator, it needs to be a NIOSH-approved respirator. KN95s are not actually NIOSH-approved, but the FDA has allowed their limited use in the current time of scarcity, of the limited use of certain KN95s for healthcare. And we believe that those respirators in this emergency are appropriate to give workers relief from the risks of the wildland fire smoke. And so we will not be addressing, from an enforcement perspective, the use of KN95s as long as they're on that FDA-approved list and they're appropriately fitted. The truth is that N95s remain relatively scarce and that they should continue to be prioritized for healthcare. We've also received a number of questions about how to tackle the questions of cleanup. We have guidance out there talking about cleanup in the fire-impacted areas, but we've all learned that we're living in smoke-impacted areas. And we've had ash, there's dust and soot mixed into the smoke, and so one of the questions is how you clean it off your cars, how you clean it off your driveways, pathways, other areas. And the important, simple message is wet it down and use less power, not more. The best approach is probably to dampen gently. Please don't use a pressure washer to do that. That'll generate more dust before it wets things down. So just something like a garden hose and not using a sprayer. And then if you can, use a HEPA-equipped vacuum or just scoop it up if it's in quantities that you can manage that. If you can move the dampened material with a relatively low pressure air blower, that's probably okay too, but you absolutely should not use a backpack-style leaf blower or other air blower to clean up dry ash and dust from the smoke. Brooms can work if used properly. The unfortunate reality is that most of us don't use our brooms properly. We sweep much more vigorously than would be effective. You should still dampen the material, therefore, and it's probably better to use a push broom because that'll help you avoid stirring up quite as much dust, and it'll focus more on keeping a smooth, clean sweep. Wet, slow, and low pressure. Those are really the keys when you're talking about cleaning up this ash and soot. We're now all ready to take whatever questions you may have. We do want to make sure that we can get to as many questions about the wildfire smoke issues, and so that's what we're going to be focusing on. We won't be taking questions on other topics.
So we have questions coming in from Facebook. The first question is from Claudia, who asks, does it help to use damp face coverings for smoke?
Hi, this is Gabriella Goldfarb again with the Oregon Health Authority. So whether damp or dry, cloth face coverings do not capture the very small particles in smoke, so they are not going to be effective. If they make you more comfortable, that's fine, but people shouldn't have a false sense of protection by using any kind of cloth face covering, wet or dry.
Susan asks, since more than trees are burning, do the N95 masks protect against household toxins that burned?
So I'll take that as well. Generally, our biggest concern with any kind of fire, whether it's wood or structures that can have more toxic components to them, it really still is just the pieces, the particles. That's what causes the immediate health effects. There are also gases. Those are generally really only impacting, like carbon monoxide, for example. That really is a risk for firefighters who are at the fire lines. It dissipates quickly in the air. So those kinds of gases are not going to be a big concern for folks. In terms of the toxic chemicals that may be part of the smoke and ash and dust, in general, it takes a long exposure to certain concentrated quantities, either in your drinking water or that you're breathing for a longer time than we would expect during this wildfire emergency, to have those toxic elements be the big impact to health. You'd have to be exposed to that in an ongoing way for a long time to see cancer or other non-cancer effects from toxic chemicals. So again, protecting yourself from breathing those particles by staying indoors if you can, and taking those indoor air quality measures that we have recommendations about is what you really need to focus on, and of course limiting your time outdoors. Thanks.
Catherine asks, what is the best mask for folks that have to work outside?
So I will turn that over to my colleague Michael from Oregon OSHA.
Well, really in this context, what we're looking at is protection from particulates. So any respirator will provide that protection, and the simplest and easiest to use and also the most comfortable to wear in high heat conditions for extended periods of time are the KN95s that I was talking about earlier. Excuse me, the N95s that I was talking about earlier. And the KN95s are a good available substitute. those really, unless you're in a situation where you're actually involved in fire overhaul, so you may have issues around carbon monoxide, the N95, the filtering face piece respirator, will provide you the protection that you need. If you are facing something like carbon monoxide, then you need to be in a much more robust respiratory protection, and frankly, for most of us, we should simply avoid it.
Audrey asks, would you recommend opening windows in orange or yellow areas to clean out the air inside?
So ideally, you'd wait until you had yellow conditions, at least yellow, and then green is the best. Orange is unhealthy for sensitive groups, and it may be that because we've had such high smoke exposure over this past week, 10 days, that many more of us than usual might be sensitive. So you have to decide for yourselves, and but if you can wait until it's yellow, that would be the best.
Gabriella, this is Michael, if I could pop in on that as well. I think part of what folks need to assess is how well their system has kept the smoke out, and I think that's part of the reason that you correctly note that it really needs to be a situation-specific answer. If you've got a good HVAC system with good filtration, even in orange, you probably have a lot more smoke outside than you do inside. You certainly want to air it out in that circumstance. And if you happen to be one of those people Tom mentioned who already planned in advance and who had an extra filter, I tell you I'm going to be one of those people in the future, then you may well have been able to keep the inside relative smoke-free, even though you've been in hazardous conditions outside.
Thanks, Michael. That's great additional nuance.
Rachel asks, what do we know about the long-term health effects of the smoke?
So for most people who don't have a pre-existing condition or aren't suffering with a respiratory infection, and by pre-existing condition I mentioned heart conditions and other kind of lung conditions, or recovering from an infection, you may still experience, the symptoms of smoke impacts that I mentioned earlier will probably clear up pretty quickly, but it does depend on the individual. So you shouldn't be alarmed if you're still feeling things a week or up to 2 weeks after the smoke clears. If you are feeling more than kind of mild irritation, the cough, the nose, the eyes, you should definitely contact your healthcare provider rather whenever there's something that's really worrying you. But otherwise, even after the sky's clear, you shouldn't be too worried if you have those kinds of minor impacts for another week or two.
Julia asks, how safe is the air in our vehicles?
So if you are able to, I think most every car has a recirculate feature, and that is a way to travel safely. Of course, there is going to be some outdoor air when you're getting into your car, unless you have a garage or something like that. Hopefully people are not taking long drives, but if you turn on your air conditioner and recirculate, you're going to have pretty good air quality inside the car compared to the outdoor air.
Susan asks, how dangerous is the high CO2?
So I'll just repeat what I mentioned earlier. The CO2 disperses pretty quickly and is really a risk for firefighters. But I wanted to, because people are seeing readings, I think, for CO2 on some of the sites that are providing air quality information, I would ask Tom Roik to also talk about that from Department of Environmental Quality.
Yeah, right now statewide we have 2 places where we really monitor for carbon monoxide. That's in the Portland metro area, 2 locations. Carbon monoxide is a component of wood smoke, so we are seeing some elevated levels of carbon monoxide, but I think as Gabriella mentioned before, it's really the particulate in the smoke that is the health concern driver.
I'll also hop in. If the questioner really meant CO2 rather than CO, which is carbon monoxide, the hazards to high carbon dioxide are actually relatively minimal and primarily are in the sphere of displacing oxygen. So the focus is on carbon monoxide, folks in the public sphere sometimes run the two together. They are very different chemicals with very different risks, and we routinely breathe carbon dioxide as part of the air we breathe every day.
Oh, thanks for the catch, Michael. Yeah, I was thinking carbon monoxide because that's a gas associated with fire.
Tim asks, with all the toxic particulates in the air, how is this affecting our water supply?
So we are actually going to be putting out some more information if later today, hopefully, if not tomorrow, on our wildfire and smoke website for the Oregon Health Authority, which is at healthoregon.org/wildfires with an S at the end. And there's not information on there right now, but we will be adding information about public water systems. For most folks, if you have questions, you should contact or go to the website for your local water supply if you're in a fire-affected area. And you should be getting notices for the places that are really impacted that have, unfortunately, we have some systems that were really damaged or destroyed by fires, and others that have issued boil water advisories to stay safe. So you should know that the Safe Drinking Water Act requirements for your water providers remain in place whether or not they're impacted by fire, but what they need to do is tell you that give you a notice that you need to seek an alternate source of water if it is affected. There may be some impacts to some systems, but again, we are working with the water systems to get them to test for those and make sure that they're giving people information they need to keep themselves safe and get an alternate source of water if needed.
Lara says, I live very close to an urban fire. I want to know if fruit and vegetables from my personal orchard and garden are safe to eat.
So in general, washing and where appropriate peeling vegetables from the garden is our standard advice no matter what the circumstance, but it's especially important after a fire like this. But the produce is safe to eat from your gardens and healthy. So just wash that well before you eat it and peel it when appropriate.
Alex asks, are medical fit tests still required for N95 masks?
Michael, I'll turn that over to you.
Technically, we're viewing this as a voluntary use situation, which means that the medical screening that is part of normal respirator evaluation is not required. They should be appropriately fitted, but that's separate from the medical screening and the medical evaluation.
And Michael, I think this is Gabrielle. I think Oregon OSHA has videos on your website about how to fit, how an N95 mask should fit to get a good seal on your face. Is that right?
We do. We have we have a short YouTube video that actually shows people how to get a proper fit, a proper seal.
So you were just saying that somebody may, as part of their job, have requirements for a particular kind of test, but for the general public that's voluntarily using an N95 to protect from wildfire smoke or COVID, that there's no medical fit test required. Is that right?
Well, absolutely.
Yeah.
And the fit test and the medical evaluation are actually two different things.
Okay.
Strictly speaking, if they're not employees, our requirements don't apply to them anyway. Mm-hmm. For a respirator to be effective, it should be appropriately fitted, but that isn't something that a medical provider does, and it isn't even something that you need to have complex training to do. The video that you referenced can show that. For people who wear respirators in the course of their work, there normally is a medical screening. But when you're talking about an N95, voluntary use doesn't even trigger that medical screening. And the real reason for the medical requirement is for people who have heightened risk because they have breathing challenges, and that's something that folks should think about. And then there are respirators that have a lot more burden. When we talk about respirators, one end is the N95, another end is a self-contained breathing apparatus that a firefighter wears into a structural fire. Obviously, the medical evaluation is much more important in the case of the latter than the former.
Great. And I will remind people that there still are limited supplies of those N95 masks that we need to prioritize for our first responders and healthcare providers and frontline workers.
Melissa asks, what should workers who work outside and are at high risk do to stay safe?
So Michael, can I turn that one to you, and I'll jump in as well after?
Yeah, well, I mean, the first thing is to wear the respirator when you're working outside. The other issues to consider are working with the employer to provide relief from the smoke, to alternate shifts. For people in some jobs that involve moving in and out of vehicles, making sure that the exposure outside is limited. The same thing if your job is sometimes outside and sometimes indoors, making sure that gets distributed. For people who work strictly outside, other than the respirators, really what you need to look at doing is reducing the duration of the shifts and stopping work entirely if that's possible.
And the last question we'll have time for, where can I get a free KN95 or N95 mask?
Michael, do you want to kick that one off?
Sure. So for farmers, ranchers, and agricultural workers, who are some of the folks who've been hit hardest and also have the most urgent demands to engage in work activity, the state is distributing more than 100,000 KN95 masks within that agricultural sector. And there are a number of sites. It is available on the OWeb site about those distributions. Basically, most of the OSU, I think maybe all of the OSU extension offices are distribution sites, and there are a number of other community partners who are distributing them in various areas. So the one thing they do ask is that folks not just show up, that in order to manage the flow and to make sure it's staffed, that they should reach out to those organizations and those sites in order to make sure they have respirators and that there'll be somebody there to provide them to you.
And Michael, just to clarify some of those acronyms, are you saying it's on the OWeb, the Oregon Watershed Enhancement Board website has
Yes.
information? Okay, so folks who...
Yes, they've added it to their information about some of the grant activities related to ag. So that's one place that I know it's available. And of course, the other acronym or abbreviation I used is OSU, which is Oregon State University. But you caught me.
Yeah, so the Oregon State University Agricultural Extension Office near you might be someplace to call, or that OWeb, Oregon Watershed Enhancement Board website. And again, which are those categories of workers, Michael, for whom those KN95 masks are available?
So they're available to farmers, ranchers, and agricultural workers.
Great. And unfortunately, we don't have any, because supplies are very limited, we don't have a kind of universal site that's available to everybody to get a free respirator mask, one of these N95 or even the KN95 masks. But you can try to contact your local health department if you are in need. But really, if people can stay indoors, anybody who can stay indoors should stay indoors and make sure that those masks are available to people who don't have a choice or who are on the front lines of dealing with COVID or smoke.